And welcome to our event today. It's V is Victory, straight talk about the COVID-19 vaccine in Asian and Hispanic communities. I'm Daisy Morales, Vice President for Community Health Choice. And for Community Health Choice here in Houston, we have our live Zoom event and also streaming through Facebook as well. We will pause briefly to let people enter the Zoom room. Our program will begin in just a moment as we let people start coming in. So first of all, I'm very grateful for our panelists today. They're all trusted health leaders who are also very involved with Asian and Hispanic communities. And I will start the introduction with Dr. Beverly Gore. Dr. Gore is a longtime public health leader and nutritionist consultant working with many organizations, including the Asian American Health Coalition. And then my next panelist is Dr. Luis Torres. He's a dean and professor, School of Social Work at UTRGV, and formerly was with the University of Houston. My next one is Elizabeth Perez. She's a new director, Center for Public Affairs and Equity in Washington State Department of Health, but of course, Liz has been in Houston for a long time here with our county health department doing the same job. So we are very sad to have lost you, Liz. And my next one is Dr. Candice Rodrigo, and she's also with the UTRGV School of Medicine, Department of Population Health and Biostatics. And we are missing one of our panelists, Shane Shin with the Hope Clinic, and she's a very big advocate in healthcare in the Asian community around the A-Leaf area. And as soon as she joins, I will go back and introduce her. So our moderator today is Gwendolyn Wu with the Houston Chronicle. In addition to Gwendolyn's usual work covering healthcare and related news, Gwendolyn is part of the COVID-19 help desk team at the Chronicle. So she has heard a lot of questions and has passed out a lot of information about COVID-19 to our general public. And with that, I'm going to ask Aaron to launch our first poll question.
And that's a good majority of our participants who have voted by now.
All right. Thank you, Aaron. And with that, I'm going to turn things over to Gwendolyn. And here are the results. I guess if you don't see them, 57% of people have already received the vaccination, 21 are ready to get their shots, and 7% are still waiting for some questions and want to learn more. And 11% are saying, I don't have the time and I don't plan to get the vaccine. So we'll see what happens at the end of the event and see if people have shifted. Back to you, Gwendolyn.
Stacey, thank you everyone for attending. I'm really pleased to see how many people are tuning in to learn about, how COVID vaccine rollout is going here in Houston and in Texas generally. We know that different communities of people have diverse attitudes toward vaccines and toward Western medicine generally. I know that our panel of experts here today has seen a lot in the last year over the course of this pandemic. And as the COVID-19 vaccine has rolled out over the last 4 months to hospitals and other public health hubs here in Texas. So today we're talking with the experts. These are a group of folks who are serving Asian and Hispanic community members about building confidence in COVID-19 vaccinations, what the reality is on the ground of access to vaccine among different neighborhoods, including low-income, recent immigrant communities, and we hope to answer some live questions from the audience about what we are seeing here. So without further ado, let's go into our first question. Immigrant communities often face healthcare barriers, including access, trust, health literacy, costs, and other factors. In your experience, what are the biggest issues regarding the COVID-19 vaccine for Hispanic and Asian community members? This is open to the entire group, but Elizabeth, let's start with you. What are you seeing here?
Well, thank you. First off, thank you for this important session, and I'm so delighted to be here with all colleagues and wonderful panelists. So I think when we talk about vaccine, I think we use the word hesitancy very broad, but I think it's it's hesitancy and then understanding the barriers with accessibility. And so what I have heard is, again, saying that there's issues with Hispanics have really high uninsured rates. There's, cultural competency issues, making it accessible to communities who don't have transportation. That's a big issue here in Houston. How are we going to get them into these traditional drive-through sites, or really healthcare being accessible, and just the vaccine in general in communities where people live, learn, work, worship, and play?
I'd like to add to what Elizabeth is saying. I think limited English proficiency is probably one of the biggest barriers for our community, as well as the digital divide. As Liz was saying, even though we have these vaccine hubs, which are great, and they are providing vaccines to thousands of people, many of the people in the Asian community who have limited English proficiency don't know how to get there, are not familiar with those locations. So that's another barrier.
This is Luis. I would add misinformation as a huge barrier. We're talking earlier in the preamble where we were setting up about the need to unpack the Asian community and the Latino community, because the rates of vaccination are not the same across all subgroups within those. But a lot of it has to do with misinformation, lower levels of health literacy, and even in the messaging. So we're trying really hard down here in some of the work that we're doing through our Texas SEAL Consortia with getting away from even the term hesitancy and talking about increasing vaccine confidence in our communities. Because, when you call somebody hesitant, or when you use the term, hesitancy, it implies a value judgment. That's the whole issue with the folks who don't believe in vaccines. If you start your dialogue by referring to anti-vaxxers, the dialogue has shut down completely. So accurate information is really, really critical.
And I also would like to just echo some of the things that Elizabeth was saying with regards to obstacles to get to vaccine distribution sites and get the vaccine. And while there is misinformation and people need reliable sources of information to get their questions answered about, whether or not they want to get the vaccine, once they decide to, we are finding more and more that getting the vaccine and getting to those sites, because there's a lack of transportation, or there are mobility issues, or there is fear about what one might encounter, or whether or not someone will have to present, an identification and things like that. So I think up front, we could probably do a much better job of preparing people for that process, and then asking, are there ways for us to go to them, meet them where they are in their neighborhoods, in their pharmacies, in their community centers, instead of asking them to come to us?
Thanks, everyone. So I wanted to dive into some of the specifics of this. So, let's start with the Asian community here in Texas. I understand that it's not a monolithic population. Different cities might have different larger groups of certain demographics. And of course, with the recent rise in anti-Asian violence, there are a lot of questions swirling around coronavirus, how it links to Asian Americans, how it affects the population, and also about vaccines. So I'm wondering, what are some of the additional barriers that we're seeing with Asian Americans here in Texas that might be preventing them from getting the COVID vaccine? Dr. Gore, do you want to take this one?
I guess I have to, but the other team could chime in as well. And I certainly hope my colleague Shane shows up. One of the reasons why I really wanted her to be here is because she is the COO for the Hope Clinic, which is providing on the grounds vaccination efforts. But in answer to your question, Gwendolyn, as I said before, I personally have been able to, and I'm glad, help people find resources for vaccinations. As I mentioned, they often can't, they don't understand how to register for the vaccination. And I kind of want to highlight a couple of success stories in the Asian community. Is that the Chinese Community Center here in Houston set up a phone number that you could call, and people would speak to you in Chinese, in Cantonese, Mandarin, Vietnamese, other Asian languages, and they partnered with a pharmacy who would administer the vaccines to these individuals. So that was very appropriate, because I realized that public health departments can't provide language capacity in every single language. And another story that Shane has told me is that in the refugee community, as Louise was saying, there's sometimes a lot of misinformation. She's finding this particularly strong among pregnant refugee women, that they're still not sure if the vaccine is safe for them and their baby. So the misinformation, the lack of a digital communication, as well as just not understanding where to go, transportation barriers. Those are probably the main things that are going on in our community.
Right. And of course, similarly, there is a lot of diversity among Hispanic groups here in Texas, whether it's the country of origin, whether it's mixed immigration statuses in households, or the length of time in multi-generational households here in the US. We're wondering, what are some of the additional barriers that Latino communities face with the COVID-19 vaccine? Dr. Torres, do you want to take this one? Oh, you're muted.
There you go. Thank you for reminding me. The issues are very similar, right? So we're in the Rio Grande Valley right now, and down here about 94% of the population is Hispanic or Latino. And I've been here 7 months, and I'm joking that the other 6% probably are too and don't know it, right? So we have a large Latino community, but they're not all the same, right? So there are many differences in those communities in terms of nativity, some that are born in the US, some that are foreign born, immigration status, educational level, socioeconomic status, all of those kinds of things. So we need to try to unpack those things. The barriers might be different for different subpopulations, right? So we have, for example, the University of Texas, Rio Grande Valley, where Dr. Robledo and I are, we're one of the distribution hubs for vaccine down here, and we have a community-facing portal where folks can go in and register, and based on the criteria they get called. It doesn't matter, for example, if you're documented or not, but we had a situation a couple of weeks ago where, despite all of the training that the people that are on the front lines are receiving, there was an unfortunate situation where somebody was turned away because not having documentation with them, right? And so we corrected that. There was a lot of communication sent out through the media to our communities, but all it takes is one instance like that, and then this thing gets amplified through the social media circles, through the folks who love to just prop up misinformation to keep people away. So we have to be really, really vigilant about those kinds of things, and make sure that we educate at a level that the different groups can understand. So we'll talk about rates later and talk a little bit more about this unpacking. But the barrier, what I'm trying to say is that the barriers are going to be different depending on which subgroup of the Latino community we're talking about. And the same is going to be true with the Asian community. They're really not these monolithic communities like we like to think, because it's just easier to think that way. Dr. Robledo was talking about transportation, where there's some people down here that live in very remote rural areas, and if they don't have transportation to get to a vaccine site, that's going to be a problem. Language is an issue, and we're trying to address that. We have a lot of people on the front lines of our vaccination efforts that are bilingual and bicultural, and they're trying to embrace and engage with the community at their own level in their own language. There are parts of Houston and other parts of the country where that's not possible, where you have people who don't speak the languages of the population that you're trying to serve. That becomes a huge barrier. So we really have to try to drill down a little bit about which subgroup we're talking about and what barriers are specific to that subgroup before we can try to address them. It's not a cookie cutter approach.
And if I may just add a couple of things to that. One, with regards to, where are people getting their information about COVID-19 and the vaccine? And that differs based on age, but we do know that a lot of misinformation about COVID-19 and the vaccine is found online. And so we also know that while social media sites like Facebook and Twitter have done a really good job, or at least attempting to identify this information and label it as not factual, that there is a lag for that information when it is presented in Spanish. And so misinformation that is shared in Spanish is often not, looked at as critically as information in English on some of these sites. So that's something that we need to keep in mind. And another thing that a community member, a community health worker, brought to our attention at one of our recent meetings is that a lot of the information and things that are happening, the sharing is happening amongst adults. And so we're leaving out adolescents and children. And for Hispanic families, oftentimes adolescents and children tend to be ambassadors of information for our families, right? So they're the ones really curious, asking questions, trying to find accurate sources. And so I think as we begin to expand our outreach, we need to start including some of those younger groups because they really do help their families make these decisions.
Right.
So, and I'll just add, I wouldn't be a good public health steward if I didn't talk about the other barriers of a very strained public health infrastructure that is not designed to be accessible for communities, right? We are scaling up for this pandemic to respond to community needs, but we never had the infrastructure to ever do it. And in general, you have a healthcare system that is not easy for patients, right? It's not made to be accessible. It's not made to be easy and just getting people that type of information. But I also think the other thing we have to talk about when we talk about barriers are these things that we call the social determinants of health, right? If you give people, if people have the option, do I need to skip work to go and, to go get vaccinated, but I have to put food on the table. We're asking people to make really hard decisions, and the vaccine, just being able to vaccinate people needs to be easy. It needs to be the easy decision for people. So, I'm not going to sit here and sacrifice putting food on the table so I can get vaccinated, as much as we want to believe that. The reality is people are having to make really hard life choices. And so I think those are some of the other barriers. It's education, it's work, the opportunities, it's healthcare, it's being accessible, it's being easy, it's having information that's culturally and linguistically appropriate. It's all those factors. And then now we snowball it into this pandemic and we're like, hey, go get a vaccination. But we have all this, we have a whole system that was not designed to serve a lot of communities, to be honest.
Right. Yeah, we are definitely seeing that here in Houston and throughout the state. All right. So Erin, would you mind launching our second of 3 poll questions? I'm going to give everyone a minute to answer this one.
And we're at a good number of responses. Over 3/4 of our folks have responded.
Great. Let's see. Can we put the results up on the screen? All right. So we're seeing that about 89% of our participants today have a trusted source for the COVID-19 vaccine. So that's pretty good to know that the information is getting out there. All righty, back to the questions. So this one is for Elizabeth and Dr. Gore. We've definitely seen in Asian and Hispanic communities, questions around traditional medicine and treatments that differ from Western practices. Cultural sensitivity in healthcare includes talking with patients and community members about when you can't quite rely on, using the Tiger Balm anymore or vapor rub, and traditional cultural treatments isn't always enough. So, that's when we need community leaders to step in with trusted solutions about, the COVID-19 vaccine and other treatments that are being used in hospitals. Can you share with us any concerns that you have been hearing from Asian and Hispanic patients and communities here in Houston and Harris County?
I have to say that, I think we when we characterize why people may not take the vaccine, we often say in the Black community, there's a mistrust. And I have to say that there is a level of that, I think, within the Asian community as well. It's probably not one of the primary factors, but it's one of the factors that I think keeps people from doing that. The other thing that I wanted to say is that many Asian people who are immigrants often don't use the traditional communication channels that we as English-speaking individuals do. I ask my friends who are immigrants from China or other Asian countries, so what's the chat on WeChat? Because, you know, I have to say, we often don't access those sources, or as an American-born Chinese, I don't speak Chinese or read Chinese, so I'm not able to see what's going on. But I think that there may be some level of misinformation that is going out through some of those. And then I know when I was working with the Houston Health Department, I really tried to make it a point to access and reach out to the Asian ethnic media, because they are an important source of information for those communities. We found particularly with Vietnamese radio and Chinese newspapers, those were good sources. And then the Indian community has also their own, or the South Asian community has also their own media channels. But something important to realize is that many Asian refugees and immigrants, recent immigrants, aren't even literate in their own language. So you have to go out verbally to give messages from trusted champions. And I know at the Houston Health Department, we had a young lady who was from the Burmese community, and we would send her out all the time. They trust you, Mary. You can go out and talk to your community and they'll believe you. So that's what often you have to do to get reliable information out.
So I would say for the Hispanic community, I think a lot of it's very similar to the Asian community. I think one of the things that we recognized very early on was, as a government agency, we're not going to be the source of, you know, people have a mistrust in us, period, right? And for historically good reason. I think, unfortunately, the elephant in the room is that the pandemic got very polarizing politically, and I think that has also inhibited us making in public health in a lot of different ways. But I would say that we did recognize that, hey, I can't be the person to tell you this information. So we very early on used community health workers and promotoras de salud and a bunch of individuals who were from the community that understood a lot of the challenges, and we used them. And we, you know, the county still uses them as stewards of information. And so they would be the ones that would sit at, you know, they would go to the flea markets, they would go to the supermercados, they go to Asia, you know, Chinatown, and they go there and they provide all this information because it's about being visible and using that opportunity. And when they see someone who looks like them, who is from their community, who can relate, they then plant a seed that helps the rest of us. So I think using those types of things, I will say that we also, one of the things, and I think Dr. Robles brought this up, is children. We designed a whole COVID coloring book for children in English and Spanish, because children are very persistent and they could be good stewards of information, and they honestly are used a lot to deliver health information to families. And so we, you know, figuring out where you have those, who can be those champions, you know, working with places of faith for a lot of different cultures is really important. And so I think that's the other opportunity that you have as well.
Yeah, Elizabeth, I really liked what you said about how children are often the kind of stewards of information. I remember doing that a lot with my parents as, you know, the American-born Chinese Vietnamese kid, and my parents both being immigrants who, you know, speak English, but might not have the same level of literacy that even I had when I was younger. So this next question is for all the panelists, and I think we touched a little bit on lots of themes here: vaccination rates among certain neighborhoods, you know, barriers to access, both technological and language. But I'm really wondering, you know, given the trends that we are talking about here, What messages are you and your colleagues using to help increase vaccine confidence among those who aren't quite sure about the COVID vaccine yet, / access in Hispanic and Asian communities? Dr. Robledo, do you want to take this one?
And Dr. Torres, please feel free to jump in, because I feel like we are taking a very individualized approach. So, Dr. Torres has a huge army of social work students that he has trained in motivational interviewing that are talking with people over the phone, and asking, what are your questions about COVID-19? What are some of your concerns? What kinds of information are you looking for? And then assisting them in those efforts. And so we are taking a very individualized approach. And so it takes a lot of time. It takes a lot of training, I think, on our staff's with regards to how much time they're spending training these students, but I feel very effective, very effective.
Unmute button. Yeah, from the very beginning, when we started this SEAL project, many of our colleagues, and this is a Texas-wide consortia led from the University of North Texas in Fort Worth. There are projects in San Antonio, in Dallas, Fort Worth, in Houston, in the Valley. Many of the colleagues in the consortium were very, very clear that we have spent decades building trust and capital in these minority communities, and that although the funder, the National Institutes of Health, really at the time this was launched back in the fall, early fall, the focus was on recruitment for clinical trials, is shifted now more to vaccine confidence and creating vaccine confidence and vaccine uptake. But even from the beginning, when it was about clinical trials, we took a very hard stance that we were not going to compromise our relationship to the communities and give them only half the story. So that the conversation starts with acknowledging what Dr. Gore and Elizabeth was saying about the mistrust in the community. The conversation starts by acknowledging that there are many, many reasons why we're not trusting messages from the government, from the speed at which these vaccines have been developed, which it's not that strange when you understand the technological advances that we've made, but people who don't have that level of health literacy sophistication are going to remember that it used to take 10, 15, 20 years to develop a vaccine, and now we have one in less than a year. What's up, right? That breeds distrust on top of the distrust that was there from the beginning. And so the entry to the conversation is you have every reason to mistrust this. And then on top of it, there's all of the ambivalence that we feel about making any type of health behavior change in our lives. And then from there, the conversation becomes more individualized, like Dr. Robledo was saying, about what are your individual risk factors? What do you know about COVID? What do you know about trials? What do you know about vaccines? And slowly getting the person to a point where they have enough information and enough comfort to at least seek additional information and hopefully eventually make the decision to participate in a clinical trial or to get vaccinated, right? And and I think there's also some norming going on. The more of us do this, I've had both of my shots already. And I was one of the lucky ones that didn't have any side effects with either shot, but some people actually have had side effects. We have to acknowledge that as well. We can't just dismiss it and say, oh, it's going to be fine, because then somebody has an adverse reaction and we've damaged that relationship. So it has to be an honest and open conversation with all the reasons why we must do this and all the things that could potentially go wrong and all the reasons why we don't trust it, right?
And I also think something that's really powerful that's happening is when you see our staff meeting on a weekly basis, they are sharing with each other what are some of the biggest barriers that they are getting when having some of these conversations, and they troubleshoot and they share resources with each other. And so I feel, over this past year, our staff has increased their capacity to sort of manage a lot of this misinformation, as well as provide really great resources back to our community to help them make this decision.
So I would just to add on to that, because I think it's really impressive what the equity team has done in Washington. they've given, and I think it's a great model, realizing that they were not going to be able to have the same type of relationships with communities. They've spent millions of dollars giving small grants to community-based organizations so they can be the stewards of providing that type of information to the communities that they're already embedded in. And then not only that, but they were really responsive in translating information in 36 languages, which is really, really impressive, to be honest, I think, when you look across the system. So I think also looking at the opportunities to fund those groups that are already doing the work, they're already trusted in the community, is got to be key as well.
I agree totally, because another success story in our community was the Vietnamese American Medical Association, the Doctors Association, and the Vietnamese Nurses Association. They were the ones who did the outreach to the Vietnamese community. And then they partnered with the Hope Clinic to provide the vaccines to the community. But they all showed up on one day. You didn't have to register, you just showed up and got your vaccine, and that people could speak your language and could register you into the system and so forth. But those are the kinds of things that requires to have successful outreach to, and I hate to say sometimes hard to reach communities like those who have limited English proficiency or just don't trust the government that much. I really like the fact that Dr. Torres has mentioned your words count, because I hear our elected officials often say, we're going to follow the science. But I think that there is a lot of mistrust in the science, because as he mentioned, there are some people that don't understand that as new discoveries, new information is understood about this COVID virus, which was, like we said, is a novel coronavirus. It hadn't been encountered before. We don't know some of the things. So all the things about, well, first you tell us to mask and now you don't tell us to mask, or vice versa. And it's very confusing, and it actually adds to the mistrust, I think, when CDC or other governmental agencies issues recommendations. So I like his approach that you have to say, what are you hearing? What are you understanding? And then trying to address those issues from there.
Right. All right. So, we've talked a little bit about this, but I want to make sure that we have a chance to explain further about it. We've been hearing a lot about language needs and how to confront misinformation on social media. We mentioned earlier WeChat. There are definitely other applications out there that people are using to talk about the vaccine. And so I am wondering, how important is it to have educational materials in languages other than English, and using dual language materials as a best practice? And of course, how do you do that as well when you're debunking misinformation? Dr. Torres, you talked about this a little bit earlier. Tell me a little bit about your thoughts on this.
It's critical. I mean, that's how important it is, right? The messages have to be delivered in the language that the audience speaks, and even we've spent so much time. One of the things that caused our project to be delayed a little bit across the whole state was the survey. There's a survey component, and trying to figure out what were the common data elements that we wanted to collect, but also the level of the language that they had to be in, right? This had to be at a level that anybody can understand it, regardless of their literacy level, right? And then translating it to Spanish and taking it into account that there are many different Spanish subgroups that speak many different versions of Spanish. So there might be words that are different. So it is a very time-consuming process, and that's where you call in the experts. One of the folks that is part of the Texas Seal Consortia is a leader of community health workers, promotores y promotoras de salud, who really understands the Spanish that's spoken on the ground level by various communities and could really tailor. We just think about, oh, let's translate it. No, it has to be contextualized and tailored to the population that you're speaking to, right? And we also have to have materials that are available for folks that are not literate, right? There are folks in our community that have very, very little low levels of reading, of literacy. So you have to have other ways of reaching them with information. So it's critical. It's really critical, and we must invest more in that. And unfortunately, of cities like Houston, for example. I lived in Houston for 12 years, is remarkable in that sense. The dozens of languages that are spoken across Houston. And from a public health perspective, there's always an effort to have materials available in many different languages. There are other localities where either they don't have the resources or the expertise. So you're lucky if you get things in English and Spanish. And sometimes, it's Google Translate Spanish because you don't have the resource to have somebody contextualize it. So language matters. We really have to make every effort to make sure that the messages are in a language that the community is going to understand.
Right, absolutely. And to look a little bit further in terms of the health equity gap, I know in my own reporting that I've done with my colleague Jordan Rubio, we had seen that of 20 zip codes in Houston that had the lowest vaccination rates per capita, 17 were majority Latino. And of course, that raised a lot of questions for us about the health equity gap and access to the vaccine for different ethnic groups. I'm wondering, how can we close the gap and help more Asian and Hispanic Texans get vaccinated? Elizabeth, do you want to talk about it from the public health perspective?
Yeah, and I think you've kind of heard throughout our time is there's a lot of different things. One, it needs to be easy. It needs to be easy, and people just need to be able to walk in, get vaccinated. It's got to be convenient. It's got to be, should be evening hours, weekend hours. It's got to be, I think it was Dr. Robles who said, we got to take vaccines to communities, not make communities come for us for a vaccine. So I think it's making it more accessible, but also it's just got to be a really seamless process. I think one of the other, besides language and cultural, linguistically, we have a science literacy issue in this country, right? Mm-hmm. People don't understand the science of it all, like mRNAs, adenovirus, the changing how science evolves. And we have one recommendation, and now we have another one because science changes. And so I think it's making it just easy for people to digest. I think that those are it's got to be very, and it just has to be, we have to make health the easy choice. And I think if we lead with that, I think a lot of will come from that, but I'll let others chime in.
I think Dr. Bettis is absolutely right. And if you look at the recent data that is coming out, Latinos are not any less confident in the COVID-19 vaccines than other groups. And I think that's like a huge kind of thing that we need to just sort of realize that it's really about access and how we get them to these vaccine distribution sites, or vice versa, get to them so that we can get them vaccinated.
Yeah, I mean, Elizabeth, you should trademark that line. Make health the easy choice. I mean, we need to have a marketing campaign and market the hell out of that phrase. It's true. I mean, there is so much information to absorb, even for those of us that make our living understanding and parceling out information. I don't know if you guys watch Saturday Night Live, but I'm a big fan. And last week's episode, they had a whole sketch about getting the vaccine. And they had three governors of 3 different states with 3 different regulations and orders and all kinds of things. And the punchline was that nobody could get the vaccine in any of the states, right? So it's because it's exaggerating and making fun about the challenges that we're having, which are serious, but it has to be made very easy. And we have to make sure that people understand that, do you need health insurance or not to have the vaccine? Well, in most cases, the answer is no, because if you have health insurance, they'll try to bill your health insurance. If not, they can bill the federal government. Do you need proof of documentation and citizenship? No, the answer is no. You need an ID because they need to know who you are, but that ID can be a passport from another country, a driver's license, a consular registration, right? So we make sure that we promote the heck out of this and then make it accessible everywhere. I think that as the single dose vaccines that don't require extreme refrigeration become more and more available, we can see efforts where they're being taken into churches and community centers and small community pharmacies. And we're already seeing them in some of the large chain pharmacies, right? So that's how we're going to really reach the goal that we want to reach, which is 75–80% of our population by the end of the summer, so that fall can look a little bit like pre-COVID conditions. Again, like Dr. Gore was saying, there's a lot we don't know about these viruses, right? Viruses change, they mutate very quickly. You know, we've been lucky that many of these variants still are impacted by the vaccine. The vaccine still works on them, and we hope that that continues to be the case. But we have to be vigilant, and then we have to help our communities understand that when the message changes because the science changed, it's because we're learning more about it, not because we're yanking your chain. That becomes really difficult when we politicize it. Like Elizabeth, you said a while ago, the whole pandemic became very politicized. And as a result of that, when there's changes in our knowledge, you know, people go to their political corners. And that's the worst possible thing for us as a community and as a country. We really do need to trust the science, but we need to understand that the science can change as we learn more about all of this.
Great. All righty. I know we have quite a few reader questions, audience questions that we've been seeing come in on the Q&A feature. So I'm going to start with some of the ones that Robin has sent my way. You know, one of the viewers had posted a question for us via Facebook asking about why some folks get side effects with vaccines and some don't. You know, this viewer in particular got Moderna and only had a small headache and sore arm. And, you know, we've definitely heard that elderly folks have fewer side effects, or if you've had COVID previously, or if your immune system is really strong, you might have a more serious reaction to the vaccine. You know, and I know Dr. Gore is our expert really on a lot of how the science is going. So, you know, tell us a little bit about what we know at this point.
I was going to say, actually, the good news is that you might have seen the headline. As of next week, March 29th, all adults in Texas are eligible to get the vaccine. Yay, yay. And I think that's really a good step in the right direction. I'm very happy about that. But, you know, it's kind of like what all of my colleagues have been saying is that we're public health people. We're medical people. We're on top of all of that. I had to tell some of my friends in the Asian community, you can go get it now, because they said, oh, I'm not 65 yet. But, you know, we have to be those ones to convey that information to everybody. So that's the good news. But you're right, Gwen, that a lot of people don't understand the mechanism behind the virus. As Luis was saying, it is the two, Moderna and Pfizer, they are an mRNA vaccine, which is a new methodology. And I think a lot of people in the past, you know, like we know, were, okay, the traditional method for developing vaccines was to give a killed, attenuated virus, and that made your body respond and develop the antibodies. This is another methodology. And like you said, because it was created so quickly, they feel like, I don't know if I can trust it, because the other ones took a long time. This one hasn't gone through thorough testing. But virtually, I am confident that the adequate clinical trials were conducted in these for these vaccines to produce them. Now, as for side effects, it's like you say, Gwen, it's very individual. And this is another thing we're learning about it, is that some people have very mild side effects, some people have very robust side effects. And it's kind of scary, but I think one of the messages that we need to say to people the benefits definitely outweigh the risk. And you may have side effects, but they're usually very short-lived and over in 48 hours, and you're done, and you're protected, at least to some extent. But if you get the virus, it's really, you know, crapshoot. You could really get very, very sick and really die from it.
Right. All right, so another question, we've actually had several questions about this that I am hoping, Elizabeth, you might be able to address since you previously worked with the county on this. Several people are asking about immigration status and documents. You know, we're wondering, do you have to be a US citizen to get the vaccine? What kind of documentation you might need to bring? What can you tell us about that?
If you're eligible to get the vaccine. There's no documentation that is required. You just need to be able to sign up. There's a lot of different systems out there and just get the vaccine. So there is no documentation that's required.
Yeah. And, you know, we're wondering as well, another question from the audience is going back to how the vaccine behaves with your body and what you need to know about your health afterward. You know, first, are people still at risk for catching COVID after they have been vaccinated? Anyone want to take this one?
I could take a stab and then Dr. Gore, you can chime in. Yes. So I think it's important to remind people is the science is still evolving because along with how people, you know, we just started vaccinating people in late December, early January. So we're still following those people across a paradigm to see how, so the science is evolving. Let's start there. It is, you don't benefits of the vaccine until 2 weeks after, if it's the 2-dose series after that. There's a science that's evolving around breakthroughs. We call them, it's the definition is people who get the virus, who can get COVID virus after having after the 2-week period of having, getting fully vaccinated. So we're still learning a lot about that. But yes, you can get it. But here's the most important thing. The vaccine is, just to be transparent, we never said it was going to be 100% effective. It's depending on the vaccine about 94, 95% effective. So I think that's important to remember. But the most important piece, and this is the takeaway that I want everyone to have, protects you from the worst outcomes of COVID, which is hospitalizations and death. So even though you may get COVID, the likelihood is you'll have very mild symptoms if you've been vaccinated, and it's protecting you and others from the worst outcome, which is probably hospitalization and death.
All right, and of course we have a follow-up to that question. And you know, I know there are some public health guidelines out there, but let's put it all in one place. What can you do and what should you not do after getting vaccinated?
Well, you still have to do all the prevention pieces. So again, if you get one vaccine, and if it's the Moderna and Pfizer, please continue your series. You know, one of them you're supposed to get about 28 days, the other one about 21 days. But it's important for people to know that you can be, if you get it on day 32, you're okay. You don't have to start the series over. And I think that's a lot of questions that we get from the community. But you still have to do all the prevention pieces, which is you still have to wear your face mask, you still have to do the physical distancing, your hand washing, because one, we still have a large population that's not vaccinated, and we're still trying to get those people vaccinated, but also you can still transmit the virus.
And I just wanted, oh, go ahead, Dr. Gore.
Well, just real quickly, Candace, it's just that that's why I have to say when CDC said that those, like a group of 4 vaccinated individuals can get together unmasked, that kind of information kind of threw me a little bit. And so I can understand why the public might be a little bit confused. Go ahead.
No, I was exactly going to bring that up. And in fact, there is a group that I follow online. It's called Dear Pandemic. The Spanish language version is Querida Pandemia. And they actually describe or answer a lot of these questions that the public has. Now that I'm vaccinated, can I see my grandparents? Can I go visit my mom? They did a great job, I thought, of describing the new CDC guidelines about people who are vaccinated gathering in small groups. And so if you have the ability or you have a lot of those questions, look for those websites. And then, you know, I think as well, like Dr. Pettis was saying, still be vigilant. We still have to be vigilant until the majority of, or more than the majority of our population is vaccinated.
Great. All right, so this is going to be the last audience question, and it is up for grabs to anybody. You know, we know starting next Monday that any adult in Texas will be eligible for vaccination, thanks to Dr. Gore breaking the news right now in the middle of our panel. We're wondering, do you have to have health insurance to get the vaccine? And if so, or and if not, you know, what are the costs involved of getting the vaccine, if there are any?
There should be no charge for getting the vaccine, or whether you have insurance or not. So that's the good news. But I think a lot of people are afraid that if they don't have a healthcare provider or health insurance, that they won't be eligible. But that should not be a fear and should not keep them from getting the vaccination.
Great. All righty, so going to take a brief break. Erin, would you be able to put the readyharris.org URL and number into the chat box so that everybody has that information? And could you also launch our last poll? All righty, so you know, we have 91% of people saying they are ready to go and get their shot after this. And so I think it'd only be appropriate to close out by asking the panel whether you've gotten vaccinated yet, and if so, what were the side effects and how are you feeling? I'll go first. I actually was able to get my first shot last week. Funnily enough, as I was writing a story about how 1 in 4 adult Texans have been able to get vaccinated by that point. So, you know, so far I have had a minor headache. I did have a sore arm for about 2 days, and I was a little bit fatigued 24 hours after getting the vaccine, but fingers crossed for round 2.
Yeah. I'll go next. Yes, I've had both of my Pfizer doses. I'm 56 and I have diabetes. I've had diabetes for over 40 years. So, you know, I was, as soon as I could, I was first in line to get it. And, you know, and in terms of side effects, as I said, you know, was very lucky, nothing with the first one, and, you know, a little bit of fatigue with the second one. And of course the arm, a little bit of pain, but, you know, my second shingles booster was a lot worse than the COVID vaccine, you know, and just people just take the plunge, take the leap of faith. You know, we all take lots of medications for all kinds of things every day that were tested in clinical trials with a few thousand people, right? These vaccines are literally being tested on hundreds of thousands of people throughout the world, right? Trust the science, you know, take the plunge.
And I will also disclose that I've received my 2 doses, and it was very similar to you, Gwendolyn. The first time I didn't really have any, you know, symptoms, but the second time my arm was really sore. I had a headache. I felt really tired that day, but it really didn't last more than that day. And I want to also add that because I have been spending or helping my older family members with errands and things like that during the pandemic. When I got that shot, it was a huge emotional relief because I knew I still had to do all of those things for my family, but I also felt that like I felt protected, and it was a huge sense of relief. And then when my family members got vaccinated, that was an additional sense of relief. My husband's a teacher and he just recently got his second shot. And so I think, you know, it was so meaningful to me and I think to my family. So I would encourage you to get it if you can.
I have received 2 Moderna vaccines and I am very happy. I have to say, even though I have health insurance, I got mine through Harris County Public Health, and I signed up for myself, for my husband, and my 95-year-old mother was able to get vaccines for all of us before our private providers opened spaces for us. So thank you very much, Harris County Public Health, and just shout out to you. As for side effects, first time I had sore arm, a little bit of lethargy afterwards, but the second time I had no side effects. So I had a very easy time with accepting the vaccine.
And I've also been vaccinated. I had the Moderna as well. I also got mine at Harris County Public Health, so shout out to them. The first time I had a little bit, besides my arm being really sore, which is common, I had a little bit of an elevated heart rate. And then when I got my second dose, I had taken a Benadryl before, and at the advice of my physician, and I actually didn't have any, I had nothing the second dose, which when people were telling me if you're older, you don't have, I kind of felt very conflicted about. So, but yeah, I encourage anyone. I mean, my brother's diabetic in California. My mom is, over the age of 65. I've been monitoring them to make sure to get them on a wait list. Anyone, if you have the opportunity to get vaccinated, please get vaccinated.
Right. Definitely understand that, because, I'm in the same boat. My dad is 67. And when he got his second dose, I was so relieved. And I was like, oh my gosh, it's going to be the first time in a year and a half that I'll have seen my parents once my mom gets vaccinated as well. So, really seems like there is a light at the end of the tunnel for all of us who are writing and working constantly during the pandemic. All righty. Let's see. Daisy, I think I will pass it back on to you.
Yes, thank you, Gwendolyn. I appreciate it. And hold on, I got my video on. Okay, well, can you hear me? Okay, the video they don't let me put my video on. Apparently it's being controlled outside of my, but anyway, thank you so much, Gwendolyn, for moderating today. And thanks to all of our panelists on this crucial conversation we need to continue having about the vaccine and the different messaging that we have to give our communities, and they're different. Communities, and we have to do it differently for everybody. Please, the most vital point about this event was to educate the public about how don't use a cookie cutter approach, because that's not the way you should approach it if you want to increase the rate of vaccines with the Asian and Hispanic community. And to just let you know that if you register for this Zoom, you'll receive an email with a link to the full Zoom to watch later. The video is also archived on the Community Health Choice Facebook page, where you can watch it anytime. And I want to thank everybody that was attending, everybody on this panel, for your time and on this very important issue and topic, and also to have a safe day and take care.